Africa. I am a staff midwife. I work under Tolong district in the northern region. I am a member of Grnma, and last year I have not been well. I was diagnosed with stage 2 breast cancer, and actually during my diagnosis I was so devastated, so depressed, because we all know what the cost of breast cancer or any cancer condition in Ghana. And lo and behold, I was one person that actually didn't believe in the dream of Grnma. Before I was sick, I always had issues with my district chairman, Mr. Augustine. I was virtually at the edge of leaving the association. But then breast cancer came in, and that was my last resort.
Hello, good evening, and welcome to another special edition of the Nurses Cafe. And today's conversation is not only about strength, right? It's not about survival, and it's not just about a journey, but it's equally about courage, resilience, perseverance, and ignoring all the odds and all the bad news. So, to be reminded that even when we face the worst things in this life, there is always a beauty in it. So, it's about two women who have decided to share their story. I mean, it is so light to just say story, but it's such a wholesome life journey. They were not born with it. They were living their normal lives beautifully. And at a junction, when they were about to branch, they had to face up with the news. But whatever the situation is, they keep enduring it. And they've been having a very beautiful conversation here. They've been sharing this information and stories all over. They are nurses, do you know? Yes. And they are here with us. And I'm going to introduce them. Today I don't have the honor to introduce them myself, but they are going to do that. And health professionals, survivors who have turned their pain into purpose. I keep saying that your pain should motivate you, but this pain has been turned into another useful purpose. So welcome, and I hope you are not going to leave us soon. I just believe that you are going to go below the screen, check on the share, and share the link, invite someone. We have to end the October month beautifully by making sure that we touch more lives. So let me introduce my guest, and then we'll go and get some commercial break, share some few things, all right? So, hi, ladies.
Hi.
Hello. Yeah, that's for you.
Power woman.
Power woman.
Awesome.
So you are welcome, and this is of so much privilege for me to be engaging with you this evening, and I hope it will be a turning point for others also. But before we go into your stories and we go on, can you let us know who you guys are, your names, what you do, where you're from, and any those kind of nicknames people used to call you and all that, you know? Yeah. So where do we start from? You are all ladies, so there's nothing like ladies first, right? So we have to start from the right to the left. Okay,
right.
So yeah.
All right. I am Elsie Salina. I'm a nurse in practice. I work with the Trust Hospital, and I'm a 3-year breast cancer survivor.
Wow.
I'm also the founder of Medcare Hub, which is a social media advocacy group that helps me spread the word about abuse and breast cancer survival. Yeah. Thank you. Thank you for having me here.
You see, whenever you're announcing 3-year survivor, what is is there any best reaction you would expect from someone? Excited or mixed? What exactly?
Like a bit of excitement and surprise, because we don't really get a lot of people coming out to say I survived breast cancer. So when I say that I'm a 3-year breast cancer survivor and counting, I start to see like surprise on people's face. Some, oh, congratulations. And you know, people always give you like a sigh, like, is it true? Yeah.
Which was the unexpected reaction you ever had when you announced it?
That sigh of unbelief, like disbelief, like, wow, so you sitting there just like you and I, you have breast cancer and you survived it. I mean, that was one of the highest form of surprise I've got when I started to tell people that I had breast cancer.
Wow, I like that. Energy. Now you have the floor.
Make me feel shy.
Oh no. So go ahead.
Hello, everyone watching us this evening. I am Abudu Atika. I am a midwife from Tolon district in the northern region. And should I say I'm a survivor, breast cancer survivor, and still thriving?
Yeah.
Actually, I fought breast cancer twice.
Wow.
Yes. I went through it the first time and currently going through it the second time.
Wow.
So I'm on my second journey.
Wow.
Fighting breast cancer. Yes, and I am happy to be on this platform to share my story, to let the world know that breast cancer is real. It can happen to anybody, be it a man or a woman.
Wow. Okay. Now the whole thing is getting me. Should we go on? I think we are going to go on with the conversation. We don't want to break it. We don't want to break it.
That's
we don't
all.
want to break it.
That's all.
So, first and second, when did you hear about the first?
So the first was in 2022. I actually completed midwifery school in 2020.
How was midwifery school like?
Well, the anatomy, yes, the anatomy, the practical exams. You know, I actually failed one of my practical exams, which was breast examination.
Wow.
At that time, I had delivered, my baby was a week old, and I had to go in for the prize. So I was a little bit depressed, should I say depressed? I couldn't go through my notes. So I entered and my tutor was like, Atika, your this thing is breast examination. And here I entered and I was just touching the breast here and there. I didn't even know what I was doing. So the results came and I had an F. So I was so angry. I don't know if I was angry with the tutor. Shout out to Mama Sele, wherever you are. I don't know if I was angry with the tutor, I was angry with myself.
Yeah.
And I am somebody who doesn't take failure for granted.
Okay.
So I had to use my own breast to do to learn breast examination because I didn't want to fail. And yes. So midwifery school has not been easy, but I completed in 2020, had my national service. So I, like any other person, living a normal life.
So which year was this when you had your national service?
That was in 2021.
Okay.
And I am so passionate about midwifery. I actually started nursing as an enrolled nurse. But even as an enrolled nurse, I conduct deliveries, I go for outreach services, I do ANC nutrition. So I am the type that I am all over.
Wow.
Yes.
And then you got inspired or motivated to go and do midwifery. What inspired you?
What inspired me was to save the life of a mother and then a child, because with midwifery, 2 lives are involved.
Good.
Yes. And so 2021, I was done with service, waiting for postings. Early 2022, February. I don't know what I was doing. And at that time, a lot of frustrations here and there. So I registered to write IELTS. I wanted to leave the country. Yes, I wanted to go to UK to practice as a midwife because I have the certificate. And I was excited about it, making plans and then connections. Then boom. One day I was lying on my bed. I don't know what I was looking for. I was touching my breast, and then I saw a lamb. And the lamb was small, very hard, like a stone. And in midwifery school, I had a steady mate who had breast cancer. Actually, she didn't mention it to anybody. I realized that her feet were getting dark. She comes to class, she's sleeping, and then later, we're not seeing her in class. We visited her and we realized she had breast cancer. The whole breast had become ulcerated. And so, along the line, before we completed, she died.
Wow.
Yes, she died. May her soul rest in peace. I mean, wherever you are. She died. And I was with her during her last moments. Yes. So, when I saw the lamb, and I asked myself, could this be breast cancer? If it's breast cancer, am I going to die like Amina, my friend, died? And I have 4 kids. Who's going to take care of my children? What happens to my husband, my family? So, as a midwife, as a health worker, I kept it to myself. I said I was not going to talk about it. So I started praying as a Muslim. I wake up midnight and I'm talking to God. Oh God, let this lamb vanish. Let me wake up one day and there's no lamb in my breast so that I wouldn't go to the hospital. So 3 months, the lamb kept on increasing in size.
And you kept praying
And
every
I kept
morning.
praying. And so in the 3rd
Were you
month,
praying with just yourself or you were going to other places to?
no, at that
spiritual?
time I was praying because I didn't want anybody
To know.
So I wake up midnight and then do my normal prayer. So in the 3rd month, I told my husband, my dear, kindly touch my breast and see if you feel I am feeling something there. He said, yes. Whenever I touch your breast, I feel this hard mass in the breast. I said, yes, I have been feeling it for 3 months now. And he said, why don't you do the same? When I go to the hospital, they might say it's cancer. If it's cancer, it means that that is a death sentence. And what you don't know will not kill you. And so he said, no, you have to go to the hospital. So somewhere in June, so from February, March, April, so somewhere in May.
Of which year?
Of 2022.
2022. Okay.
I visited the hospital, which is Family Teaching Hospital. Then, when I entered, the doctor just touched and said, oh, this one, I think is breast cancer. I started shaking. Said, go and have a scan and then bring me the report. I did a scan.
The doctor just said,
yes, the doctor just touched there and then assessed the lamb. He was just sitting on his table, just touched and said, oh, this could be breast cancer.
wow.
So he said, but you go and then have a scan. So I went and then did a scan and then the scan said the lamb was suspicious. So then I had to do biopsy. Actually, I had 3 biopsies. The first 2 biopsies said it was normal fatty tissue. So the 3rd one, the report came on that fateful day. Here I was in front of my doctor. I said, Madam Antika, I am sorry, it is breast cancer. I am sorry, it is breast cancer. Those 3 words, my legs started shaking. I started shivering. I wanted to speak, I couldn't. I wanted to cry tears, that I couldn't find my tears. And so the doctor, we Muslims usually, you don't hug male, so the doctor went out, brought in a female nurse, and then the female nurse hugged me. And then I felt that warmth. Then I started crying. When I gathered courage, they gave me a whole bottle of water. Oh, I finished everything. And I was like, my husband, my children, how am I going to break this news to my husband? And my husband works somewhere. So the nurse said, don't worry about that. I would personally inform your husband. So he called my husband. Oh, mister, your wife did this, that. Then the phone was on loudspeaker. My husband didn't know it was on loudspeaker. And he said, where is my wife? And they said, she's here. And my husband said, Atika, I want you to know that we are in this together. We are going to fight this together. My brother, I left Tamale Teaching Hospital. I went there with a motorbike. You know, our source of transportation most of the time is motorbike. I left the hospital forgetting that I went there with a motorbike. I walked like some minutes before I said, oh, I came with a motorbike before I went back. So that should tell you how much the news broke me down. And because of Amina, so even till this, I still sit every blessed day and I see Amina, I picture. Because whatever Amina went through at that time, I was naive, I didn't know. I am facing them, I am seeing them now. The black feet, the fatigue. And so I fought through it. Then, boom, 2025. When I thought I had survived everything, where I actually had a mastectomy. So where they removed the breast, I saw another lump under the scar, and then they had to cut open again, remove the lump, and then it was cancer again. So currently, I'm going through chemotherapy treatment for a second time.
Wow.
Put yourself.
You really, Elsie was describing her as the strong woman. So where are you getting all this energy from?
First of all, it's from God. And then secondly, my husband. My husband has been an amazing support system during this journey. Breast cancer is not an easy thing. People hear breast cancer. It's not until you go through it, you will not understand. So God, my husband, and then my sisters. We have a support group. It's like a community where when I am in pain, I just put it on the page. I call Elsie. This is what I'm going through. Elsie says, oh, I went through it. I did this, I did that. And seeing Elsie knowing that she fought cancer, her cancer didn't come back. We have other women who have survived 19 years, 20 years, 26 years. Mm-hmm. I see them and I am encouraged. Yeah. And I know that if I fight and fight it well, I am also going to survive this.
Elsie.
Yes, Kobe.
You've always known her. You've described her just today, she being the strong woman. Mm-hmm. After hearing all this again, do you have any other words for her?
She's still my strong woman. She's still my strong sister.
Yeah.
And everyone's story is unique.
Yeah, great.
Everyone's experience is also unique. Mm. Anytime I hear her story, and it makes me know that you don't have to underestimate anyone's pain, because pain is pain. Pain is what the person say it is. Okay. So you also realize that if you think you've had it tough, there are others who have had it tougher than you. So you respect everybody. I have a lot of respect to my sister because she has gone ahead of me. Yeah. Getting to know her recurrence broke me down. Mm. I didn't tell her, but I was broken. Wow. Yes, I was broken. I was broken.
Like, you'll be fine. I know, right? You're going to be fine on phone.
I was broken, and you see, sometimes,
just not to cut you and just not to keep you going. How different is your story? Maybe you should share yours too.
Okay. I would say that I didn't...
But you are also a nurse.
Yes, I'm a nurse.
So tell us something about nursing. Which one was your scariest subject in class? What inspired you to go into nursing? I won't tell you much the one I was scared about. I won't tell you.
So
tell us yours.
What inspired me into nursing was my mother. She had a diabetic foot. So after my SS, shout out to all students of Ghana National College. So after we wrote SSE, and the results came. I really wanted to go to do medicine. I think the grades weren't adding up. So they're like, oh, you did well in math, do mathematics. I was like, no, I don't want. So I was still contemplating on what to do. But my mom had an experience at the hospital. I think one of the times she was going for her dressing at the surgical unit. She went there quite late, I think before midday. So they said they were not going to attend to her. And when she came home, there was no one at home. I had a key, and she had to sit outside with the disappointment from the hospital, coming home to meet a locked door, and with house flies hovering over her sore. It was a painful sight for me to behold. So when I came and she told me her ordeal, that was when I told myself that I'm not going to do this to anyone's mom or dad. So I'm going to accept and go and buy the nursing. So that was the point that I decided to give nursing my best shot, to really be kind to people. So that what my mom experienced, she would never experience that. So that was how I got into nursing.
Which of the NTCs did you attend?
Yeah, so I went to the Premier NTC.
Oh, please.
The Premier. Please.
Where they be?
Yes.
The first time.
You haven't heard
the Premier.
I don't want to mention. They've been back.
I went to LMTC Kolebu.
You see?
In fact, yes. So our president was one time my pharmacology teacher.
My school is a nice school. It's
nicer than Kolebu. It's where Pimbi NTC.
Yes.
Don't worry.
Beautiful.
But we are still the Premier NTC. So that was where. So I finished NTC Kolebu in 2008. Began to work, had my service, and started working fully from 2010. Still at Kolebu Surgical 2. So that's how I started my nursing career. Marriage took me out of the country. I actually vacated post.
Japa small.
I didn't Japa on a good note.
Okay.
But at that point, I thought I was doing the best. I was supporting my husband then to do ministry, and I knew God was going to reward us greatly. So I didn't mind living on a bad note. So we went on missions in Kenya. We spent some time in Mombasa, Kenya, and had to come back. So came back in 2012, I met embargo unemployment, and I really paid dearly for my decision to vacate post. So fast forward in 2016, I got my current job, which is the Trust Hospital, Osu. I got the job, and I had to run away from home to pick up this job because the marriage tend to be an abusive one. I mean, there was tension at home, and I had lost my confidence, I've lost my self-esteem, I was depressed, I was battling poverty and all those things. So escaping the toxic environment was a good thing for me, and getting a job in Accra too was also okay. So coming to Trust Hospital, I started life all over again because at that time my colleagues were SNOs and I was starting as an SN again, but it was okay for me. So in 2021, the marriage eventually ended, and I was so excited about it because I really gave that marriage my best shot. I sacrificed a lot, my career especially, and didn't go well. So I thank God I had a good job by the time the marriage was ending. So that was one of the things I was happy in 2021. It was a very good year for me because I got to celebrate separation from an abusive marriage. So in October of 2021, I decided to take my leave. My birth month is in October, so I was turning 35 that year. I started to do a birthday shoot, something I had not done before. So I really planned for that birthday shoot, and aside all the celebration, I was asking God two things. Because I told you earlier, I married a pastor, and I love ministry myself. So I told God that, you know what, even so have the heart for the things of God. So I really want to go back to do ministry to my family.
So whilst you're on mission,
Yeah. We have to be fruitful and multiply.
hey.
So that was my first ministry, was for my children. Then I was asking God, what other ministry do you have for me? So in that period of leave, birthday celebration, I started to go the extra mile to engage in a spiritual fast, 40 days, to seek God's face for two things: the ministry you are giving to me, and the next phase of my life. So it was in one of those times, praying on the Manfi prayer camp on the mountains, that I had this feeling of sadness, and I began to cry. So I told God that whatever it is, incline your ear to my cry. I finished the prayer, descended, and came home. So
By then, have you done the photo shoot for your birthday?
Yes, I've done it already.
Okay.
Yes, I've done it already. So I think 31st October, I was one night after my bath, I don't know, but I was just doing my regular self-exam. Sometimes I just don't follow the routine. Like I can do it any time of the month. So I think I just remember that, hey, it's been a while I did my exam, and I just took my hands around my left. At first, I started with the left breast first. Then I felt an unusual lump. Then it got me alarmed. Then I said, okay, let me check the right. There was nothing, and I came back to the left again. And I saw that, yes, there is something there. Immediately, breast cancer came to mind. Fear gripped me. At a point, it's like I was in denial. So I told myself that 8 out of 10 lumps are not cancerous. So I also chill, you are part of the 8.
How did you know that?
Statistics have shown us that 8, if you have 10 women or 10 women with lumps, breast lumps, 8 of them will be benign, and maybe 1 or 2 will be cancerous. So there's a high chance that mine could be a benign tumor. That is what I told myself.
So was it that because you were exposed to nursing and you had that knowledge, foreknowledge,
Yes, so that's why I had this knowledge, because of my background.
Okay.
Yes, so that was a Sunday evening. Monday, Tuesday, I kept it to myself. Monday, Tuesday, I told my mom that this is what I felt. She screamed, hey, breast cancer. I said, no, don't worry. Until doctor has, until I've done all the investigations, we can't say it. So I laid her fears, and I also encouraged myself. So 3rd November, I resumed work, and it was our wellness clinic. So I went to see the doctor, and I complained of feeling this lump in my breast. Yes, she examined me and said, yes, there is a lump there, so go and do breast or ultrasound. So the first ultrasound I did scored me BRAD 1A, which was like a benign tumor, but there were 2 large lymph nodes in my left armpit. That is what got me alarmed. The sonographer said it was nothing, and said maybe because I was breastfeeding and all that. And I was like, no, I had stopped breastfeeding a year earlier, so there's no way it could be accumulation of milk or something. So he asked that I just use warm compress, which I started until I wasn't convinced, then I stopped. So then I went on to do the 2nd and the 3rd scan. So it was the 3rd scan that actually scored me BRAD 4A, which was highly susceptible of malignancy. It was interesting to know that I had that result in my hands, but it didn't click that it was something serious until I showed it to my doctor. Then she did something beautiful with me. So when she just opened, and I'm sure when she opened, she was just going to the recommendation. She didn't read anything. All she wanted was, what was the recommendation? And it said, highly susceptible of cancer. Then she just gave me a hug.
That's news.
Wow.
Yes. So she didn't tell me anything. She didn't say anything. She just gave me a hug and said, Elsie, we are fighting this together. So that was when I remember that, what I read BRAD 4A, it's actually it's. and I saw fear gripped me, and I felt death was very close to me. I began to cry. We were all crying. She was that close to me also. That's a doctor. And so I cried and I said, God, who will take care of my mother? And who will take care of my 5 children? My youngest was 2. How could I survive an abusive marriage where I could have died? I had depression, I had bipolar, I had threatened abortion when I had my twins. I had lost my job. I have lost everything. I was at the lowest point of my life. So if God has given the strength to come out of this, why should this thing be, me of all people, why should I be hit by such a news? God, my enemies will laugh at me. They will say that I have done evil to a man of God, so God is paying me. They will say that all this I want to leave, see where you've ended. So I'm going to ask God all this, so why should this happen to me? But what my doctor told me really helped me. She said, Elsie, see yourself surviving this thing and being there for your children, even being there for the little one finishing university or any other higher education she wants to go. So, and she gave me so much, she also assured me that I'm going to make sure that you get support from the hospital. So that also, so after crying, you know, sometimes when someone is crying, it's not because of the pain, it's because of where to get funds for the treatment. Aside the pain and the bad news, now where to get the money. So when I knew that my hospital would take care of my medical bills, I cried, but like I had a sigh of relief that, I mean, it's going to be an easy road. So that is how I started. So I started on a very good note with my doctor prepping me and helping me to be very optimistic about the outcome of this treatment. So I went on, and I was hoping, you know, I was still in the fast. Don't forget, I was still in the 40 days. So as of November, I was still, yes, I was fasting, asking God, like, what should I do next? And I want to really make them. I don't want to miss anything, any decision that I will take again. So I was still trusting God that this lump that they've seen will not be cancerous. But I was still doing the biopsy. I still did the CT scan and everything. And before I went for the final results from the pathologist, you know, they will give you the sample to send it yourself, either you or your relation. So they gave me that sample with the tissues of my breast in the formalin container. And when I got to the entrance of the pathology lab, I just took it and I prayed. I said, God, turn this thing. If actually there's cancer in this thing I'm holding, do something about it. And I sensed it. I knelt down and I prayed before I went to the lab. I presented it and I had to go for the results myself. That's one of the difficult things that patients go through. They go for the report themselves, and those who are literate can actually read what it is before any specialist or any doctor breaks the news. They already seen it. So I went for it. I think that we should find a way of getting the report to the clinicians before the patients come, because some people will go for it and they will never come back to the hospital.
Yes. Myself, my report was sent to me on WhatsApp.
Wow.
And you can imagine.
Yes.
That day, in Northern region, we're celebrating Fire Festival. I said, no, I won't open this report. So I went out.
To enjoy the fire
festival.
Because I know they could start from one street, dance all the way to somewhere, and they will splash water on them, right?
Yes.
Then they'll finish and continue. They go and drop the sticks somewhere. Why did they drop the sticks to the fire somewhere?
To cleanse for the next for next year. Cleanse yourself.
At that point, were you having this thoughts of the breast cancer?
Yes.
Did you involve it in the whole thing?
I was dancing, and then whilst dancing,
it will come to mind.
Because I didn't open the report. So I will dance, and then I'll say, what if? Get your point, what if? So then
you still went for it. I see.
So the next morning I went for the bad news.
Yes.
We'll come back to you.
Okay.
Right? So Elsie.
Yes. So when I went for the reports, you know, they give it to you sealed. I opened it gradually. Then I started to read from address.
Why did you start from the address?
Because I want to read everything. But I started from address, I started from PO box, everything, telephone numbers, pathologists. Then I came to the name of the patient, age. I read.
You know the name of the.
No. I wanted to. I read everything meticulously until I got to the sample being metastatic. My heart sank. I was there. I just knelt down. I was like, no. But before then, this hymn came to mind. It is well. So it said that whatever my lot, God has taught me that it is well. So before I went, I had signed myself for the good and for the bad. So when it was the bad, it was like I was cool already. Like I had signed myself that it can be cancerous or not. So when it was cancer, I felt the pain, but immediately I just encouraged myself. And I told myself that it is well. It is well. So that is how my journey started with chemo. With chemo, I had locks on, beautiful locks. A day before, my loctician came to tighten, retighten for me to look very nice. I was really ready for this thing. So I had my first chemo with my hair on. Then after that, my oncologist nurse specialist said, Elsie, by the time you come back in 3 weeks' time, there'll be nothing on your hair. I was like, I knew my hair would fall off, but I didn't know it would be this quick. Then I said, you know what? I won't wait for cancer to shame me. I will shame it. I will shame cancer. I want to face cancer head on. So I went on to shave my hair.
Wow.
I shaved it, yes.
Yeah, for me, I waited for cancer to shame me.
You wanted to?
Because I
really experienced it.
I had locks.
You had locks?
Yeah.
So I shaved my...
Mine started falling naturally.
Oh. Do you still have your locks?
It all went off. You wake up and one is lying here and the place is Sakura. Another time you are walking, maybe in the market, then it falls off. Or I remove my cap and then I have a 5, 6. So like that. So everything went off.
So I had to cut it off. I kept it and used it as a wake up. So eventually when it was falling off, it was just the short hair that was
prepared.
Cool.
I like you.
I really kept it, and I was like, so at a point, I told my kids that I wanted to be like them. That's why I have cut my hair. Now when
so your kids.
I know. I told them first.
Okay.
That I wanted to be like you people. So I just want to have a low haircut. So when it began to fall off, I was like, Mommy, what's happening? I said, it's a drug I'm taking. Eventually, when I went bald, they call me Mami Santo. Mami Santo Pete. And we all make fun of you know, the caps I used to wear. Mami Santo Pete, yes. So, you know, I have a series of caps that I use. So sometimes when there's a knock on the door and I'm going out, that I even forget to wear it. They don't even pick it for me. And they'll report, Mommy, wait, your cap. There are days I had gone out without my cap. I mean, I just forgot that I had to put something to cover my hair. So that's how I went through. With my wig cap and other wigs, I was wearing it, blah, blah, blah. I learned how to do makeup because every hair was gone. Imagine, every hair was gone.
Even your private
parts, on my skin, everywhere. It was like with my eyelashes and then the ones in my nostrils.
Why would you be losing hair?
Because of the chemo. The type of chemo that I received goes through the whole body. It's not the targeted one that we have. There is some that is targeted. That one only identifies cancer cells. But this other one, it's like an infusion, goes everywhere. Since the drug cannot decipher which one is a normal cell, which one is a cancer cell, it fights everything. So that is why we get the adverse effects of the hair loss and other systemic effects like nausea, vomiting, GI issues, darkening in skin, all this. But eventually, you know, the normal cells replicate itself. I mean, they grow back, but the cancer cells die off. So these are some of the effects that I had. The numbness.
How were you dealing with I wanted you to finish on the hair bit.
Yeah.
Because your hair takes you to the social gatherings and events. So what happens? How were you dealing with this?
So when I'm in the when I'm home, I like my peace of mind. But when I'm stepping out, I have these caps I wear, different ones. And when I'm going out for functions, I have that's my locks that I use for the wake up. I have that one and other two, so I could change it, use it interchangeably. Yes, so that was how I managed the hair loss.
Okay.
Yes, I had my own hair as a wig cap and also other weave-ons that I use. Yeah. So let me wrap up. So with the chemo, I had eight cycles of chemo and had to do surgery. Initially, I wanted to do a double mastectomy because I realized that there's a thin line between life and death. And life is very fragile. So I wanted to take the best decision to stay alive. So I said they should even remove the two. But when, yes, I just wanted to be alive. So, but when I had to do chemo before surgery, by the end of the chemo, the lump had disappeared. And now I was contemplating whether to go for the surgery or not. One, I was afraid of the general anesthesia. I've heard about anesthesia death. What if I sleep and I don't wake up? What if my spirit goes and it doesn't come again? What if a mistake happens, some negligence? All those things when I was scared. Aside losing the breast, I was also scared of the anesthesia. But so some of the doctors told me that, you know what, some of your consultants are survivors. Yes. One of my breast care surgeon is actually a survivor. So he said, you know what, because they are survivors, they know what they are about. And they have seen many women who have refused surgery and later come back in with advanced cases. So it's in your own interest. And he's talked about the breast reconstruction too, and also or breast conserving surgeries. But at that point, the only option for me was the mastectomy. So I said, okay. At that point, there was a word dropped in my spirit that better safe than sorry. It's better I'm safe with one breast than to keep the two and lose my life. Because I really wanted to be alive. So that was how I accepted the surgery, went to do the left mastectomy with axillary lymph node clearance. After that, we sent it to pathologists and there were still some cancer cells in my lymph nodes. So I had to do radiation. So I had 25 cycles of radiation. That's like 5 weeks interval. One funny thing was that when I started with the radiation, I came down with COVID. You know, because the people in the center are all immunocompromised. You know, the chemo makes you, immune system goes slow. So if you are come with COVID, then you're going to rather affect other people. So then stay home. So I stayed for like 4 or 5 days before I continued with the radiation. So fast forward. At
that point,
yeah.
Did your anxiety and fears worsen? You are battling with cancer
and COVID.
And you get infected with COVID.
Oh, I saw COVID as like normal flu.
Oh, you did?
Oh, yes. If I'd be able to go through chemotherapy and surgery, COVID is nothing. But my worry was staying out of treatment for a long time because I started the first, it's supposed to continue. And I stayed for like a week before going back. So that was my only fear. But eventually I did. So throughout my journey, I was very fortunate. My story doesn't depict the typical Ghanaian woman or the typical African woman who have to struggle to get her treatment done. I had a lot of support from my organization, my facility, taking care of my financial needs. They also care of my emotional, psychological. My family was there, spiritual support was there. Treatment was also available. So surviving it was a bit easier for me. So I realized that the ministry I was asking God for, this is it. And the life that I was asking God, my life has taken a different turn. I started a social media platform, the Medcare Hub, where I talk about abuse, because in my previous marriage, I suffered abuse ignorantly. So I wanted to use my life as an example to help others identify abuse signs and avoid them, or if they are going, if they are in it, what they can do to come out of it. Then I also do the breast cancer thing. So I saw that God just wanted me to just go through the situation, to give me a story and to give me a voice so that other people could benefit. So as I was going through, I was just the normal happy person, knowing that at the end of the day, I'll have a platform like this where I'll sit and speak to my fellow colleagues in the nursing fraternity, or women everywhere, that there's hope after diagnosis. My story depicts hope, faith, and resilience, because I was able to add my Christian faith to the treatment, which most of my Christian brothers and sisters don't do. We tend to be more faith-based than physical, but God is physically present in medicine as much as he is in the spiritual realm. So you can't accept one and leave the other. That is what helped me. So I told myself that faith and science work together. That was how I put my faith and the treatment together, and I was, because I believed in it. Habakkuk 2:3 says that the just shall live by his faith. So I realized that my faith was enough to help me to survive it, believing in the treatment, and also helping me to survive. So that was my journey so far, and God has been so good. My advocacy has reached a lot of people, and I have few people who could testify that because of my videos, they've actually did the examination, they found that they had lumps, the lumps were cancerous, and today they have survived it. So that is the beauty of my story.
Elsie landed on the faith, and that's really beautiful, reassuring one. And thanks so much for sharing all these things. I mean, you poured out a lot of very sensitive information, but I'm sure you wanted to do this to also help others. On the aspect of faith, what happened to your faith when you had to start treatments and all that?
For me, like I said, every story is unique. Every story is different. So for me, when it came to faith, I actually stopped praying. As a Muslim, I stopped offering my 5 daily prayers, because I felt like I was praying to God for the lamb to vanish or whatever. And then here I was diagnosed with breast cancer. So I said, no, there was no need for me to pray. So I will go for my chemotherapy, come home, and then I am struggling. Yes. I think it went on till I was done with chemo. And then that was where a friend said, Atika, even in this journey, you need God. And truly, I realized I needed him. And the funny thing is that one thing about cancer, it can make you do anything to survive. When we come here, I was telling Elsie, I felt like at a point, my grave had already been dug, and then I was lying just closer to the grave, waiting for somebody to use his leg to push me inside. Yes. So, I remember, is it 2022 December, this second chance, they had a very big crusade, 31st night. My mom called me, you have to attend this. My mom is a Muslim, my dad is a Muslim. I'm a Muslim. You have to attend this crusade. I said, no, I'm a Muslim. I want to attend that crusade. And during that time, my mom would go and buy Yesu Moja, grace powder, grace spray. I can't count, countless. They'll buy this in Sobolo. If you come home and I am sipping the Yesu Moja, it's like I'm taking the blood transfusion.
What did they say that would do?
The Yesu Moja was, I take it and then it will clear off the cancer. And my major worry was to have a mastectomy. I didn't want to have my breast cut off. Because as a Muslim woman, I felt that if I cut, if they take one of my breasts out, it means that automatically my husband has the willpower to, or he has an excuse to add another wife. And so when my mother brought the Yesu Moja, I was always on it, the sobolo. If you come home and I smear my forehead and my sakura head. Like Elsie mentioned, yes, the whole hair will go off. Me, my children would do poo and they will hit the head twice. So they were like joking with the bar hair. And I went through it. And then 31st night, I had to travel from Tamale to Kumasi for the 31st night program. My auntie, my mother, they made me lie on the floor. They gave me the sun on the land of a second chance. They smeared it all over my body in my white dress, praying over me and those things. But I went back home and the lamp was still there. Nothing changed. But for me, even though I visited those places, Grnma, people brought this cow feces, cow dung.
Mercy.
I smelled. Ant hill, sand from ant hill, whatever. At a point, one of my brother's son actually took me to a malam who said I had breast cancer as a result of my mother-in-law and then my husband's sisters. And so the fortunate thing was that I lost my mother-in-law 5 years before I was diagnosed with breast cancer. My husband, they are 4 male. They don't have a female. But if my mother-in-law was still alive, if my husband has sisters, at that stage, I would have believed what the malam said. And I wouldn't have gone to the hospital for treatment. I would have relied on the malam. And so with cancer and faith, a whole lot happens. A whole lot happens. Look,
at that point when you were going through this phase of faith, were you on treatment?
I never missed my treatment.
On the chemotherapy?
Chemotherapy, I never.
And you were still doing the cow dung and the herbal and the
I'll put
yesumoja?
it on the breast. When I put cow down 1 hour, I'll clean it, wash it and put yesumoja and then whatever. Like my bed, so they had to create a different place for me to sleep. Then boiling of herbs, these leaves and other things. I did all those things. But at the end of the day, the lamp was still there. So for me, I do those things. Anybody that drinks, my husband says, let's do it, but you have to go to the hospital. And I never missed any of my chemo sessions. So I had my surgery. So when it comes to faith, if you are not careful, at the end of the day, you even forget, you forget that God exists. By this journey, you really need God.
You mentioned your husband being the strongest of your support. What other surprising support emerged that kept you going on?
So one thing about breast cancer is that the treatments, it's not all the treatment that are on health insurance. So it comes with financial burden. So for me as a midwife, my husband is a civil servant. And at that time, you remember I told you I was just starting. And so I was still on enrolled nursing salary. I was not even enrolled on the this thing as a midwife. So how much was my salary? Less than 2,000. Each section of chemotherapy, I also had 8 sections. And each section, in every 3 weeks, I would pay like 1,500, have labs done like 500 Ghana cedis, and then you have to be on a special diet. You can no longer eat the carbohydrates and then the normal food everybody eats. And so it was a burden on I and then my husband. And as a nurse at that time, who was a member of Ghana Registered Nurses and Midwives Association, I quickly called my chairman in Tolon district and I told him, this is what I'm going through. Is there anything the association can do for me? Because I went in for a loan. It was not helping. At that time, how much can I take? My husband went in for a loan. And so our salary was just, and family members were not ready to support. So my chairman said, okay, you bring in a letter, let's see what happens. But I didn't have hope. That time, I didn't even know that GRNMA were having something like a health fund. And I was one midwife or one nurse who was highly against Ghana Registered Nurses and Midwives Association. Because at that time, there were certain policies and certain things that were not going on well. And so I was just at the verge, and that was the time there was a break out and then a new association was formed. So I was part of that new association, even though I had not left. But I was in their WhatsApp group monitoring things, and yeah, so something was like, should I ask these people for something? No, I am leaving the association. Why should I? And so when I got in touch with my chairman, he said, bring a letter. Let's see. I gave him a letter, and then boom. One day, I received a call from my chairman. He was like, Atik, are you home? I said, yes. Okay, so I have good news for you. So Ghana Registered Nurses and Midwives Association, they want to support you from the health fund.
Wow.
Yes, and so I was home, they came, and I was given a check of 50,000 Ghana cedis.
Wow.
And that day, I can't tell you right now how I felt, how my husband felt. Yes, they had taken part of the burden. And so when I had that check, quickly, I ran to Kolebu to have my mastectomy.
So that's your surgery?
Yes.
Okay.
That's my surgery. And so it helped to pay because the surgery was more than 5,000. Medications, other things. So that's money really came down. That was one of the surprises I had, and it really, really helped me in my journey. Other than that, I would have dropped out of treatments along the way due to financial issues. And I don't know where I would have been.
Wow. You speak of a recurrence, right? Elsie, do you have any fears of a recurrence?
I've tried to work on that fear as much as possible. And I am on the hormonal therapy because the tumor was estrogen progesterone receptor positive. That means it was the estrogen that was fueling the tumor growth. So I'm on hormone therapy, and it's just that they say that the prolonged use of the tamoxifen also can cause some thickening of the endometrium, and can get endometrial C and all that. But I've just known it as a fact. But for me, I don't think it will be the truth in my case. Though I have issues with the effects of the tamoxifen. So when I started, I was having some issues with my menstrual cycle and all those things. But the issue of recurrence, I tell myself that it is not going to be there, even though the fear is there. When I miss my drug for a day or two, then I remember that, hey, Elsie, this thing can come, so you better take it. You know, it's tiring to take a drug every day. It's so tiring. I'm in my third year. So the facts are that it can recur is there, but I try to push it in my subconscious as much as possible. Yeah.
How are you dealing with it?
So for me, after my first treatment, I met a survivor in Accra. So in Northern region, I had not met anybody. Because of stigma, usually people don't want to talk about it. So when I went back home after my treatment, I decided that I wanted to start an advocacy program in Northern region. And so I wanted to visit the hospital on their clinic days to encourage women or counsel newly diagnosed women. And then one nurse mentioned, Atika, so you think you are fine. You are fine. The type of cancer you have is the aggressive type, and my type is triple negative. And that one is the aggressive, they say is the aggressive type of breast cancer. So it can kill you very fast because it can spread. And like my sister Elsie, after treatment, she's been given medications that will suppress the growth of any little cancer cell in her body. But for me, it's not like that. After mastectomy, after chemotherapy, and then I am on my own. It is between I and my God. And so she said, you think you are fine? Triple negative, very aggressive type of cancer. You might get recurrence in 2 years. And my brother, that thing stuck here. I left the hospital, and for 2 years, there are days I don't go to work. I am crying. I can lock myself indoors for 3 days without bathing, without brushing my teeth, without eating. I am just lying at the same spot. I'll only get up to urinate or maybe to free myself. So I had that fear of recurrence. For me, actually, I had that fear. Yes. And so when I woke up one day in somewhere in August, then I started feeling funny. And you know, when you talk about it at your workplace, you know, it's funny, right? One of my in charges actually told me that you are always seen in town. I always see you on your motorbike in town. I see you on TikTok. And then yet you don't want to come to work. You claim you are sick. You have breast cancer. Yet you look a healthy more than those who are not even sick. But this in charge didn't know I was battling depression. Do you know along the line I tried committing suicide?
Wow.
Yes. I was stigmatized to the extent that I said, no, let me end it all. Of what use is it after I'm going to be killed by breast cancer? I woke up midnight. I said, well, let me just cut open the veins to make them faster. And then something in my spirit said, text your husband. My husband works elsewhere. So I sent him a text. And then, fortunately, around 12 a.m., he was not asleep. So he called the next morning, but they had to break into my room to take the knife from me. But I am a midwife, educated. But I felt like because of stigma. And so my child sees me in town. And then the teaching hospital became like a second home. For cancer, even those who have survived, they still have to visit the hospital every 3 months. You feel anything funny, you have to go to the hospital. Because the possibility, even after treatment, of it recurring is high, depending on the stage and then the type. And so I was living in fear. I was living in so much fear. And so in August, I went back to the hospital. I was feeling funny. Then they'll tell you that you are thinking too much. It's the psychology. You just have to psych yourself. I said, no, everything is not okay. I know my system. I know my body. And they were like, no. Even my husband was like, you like feature too much. I got to the hospital. I told the doctor, when I touch where they cut the breast, when I touch the scar, I feel a mass inside. I had a scan done again, and then they said, no, we have to open. They opened, they brought out a lamp, and then boom.
Hold on. Your breast, you find lump in it. You start treatment. They do surgery. In the course of the surgery, the breast is taken off, right? So it's now left with a scar.
Yes.
And again, there is a lump in that scar.
Yes. Under the scar.
Seriously, I've been trying to ask the right questions. And this brings me to this question whilst we are going towards wrapping up. Sometimes we mean well, people mean well, but maybe their concerns is not put in the right words. So what do you wish people had understood better about this whole experiences? And which way, what kind of questions, worsen the whole thing for you? You have espoused quite some of them very well. So how do we ensure that we approach all these situations using the right words and the sensitive approach that can help you regain your confidence?
So sometimes it's not just about words, even eye contact. For somebody like me, today I am on social media and I am speaking to over thousands of people. And I've been bold enough to tell the world that I am working currently with one breast. And so the moment probably I go back to work, I'm in the market and somebody watches this, the person is looking at my chest like,
Looking for what there?
to see the missing breast, which of the breasts. And I have gone through this. And at a point, because we use veils, so at a point when I am going out, I have to do my veil like this to cover my shirt. It might not be intentional. You understand? It might not be intentional. And then others will say, oh, it's not only you who have breast cancer. You are exaggerating too much. One thing that hurts me a lot is when people tell me that, oh, it's psychological. Your own dear is mental issue. You are exaggerating. You are thinking about it. It's not anything. I know one woman who also had her breast cut off. She went through the treatment. She's fine because you are a health worker, so you know everything. You know, but my brother, just meeting me and telling me that, Atika, you will be fine. I am praying with you. These words. My area imam came looking for me. And I was like, why is he looking? I was wondering when I came there, said, I said, why is this man looking for me? I go to the mosque and then I come back home. I have never met like one. And so, and I used to give money every Fridays for them to pray for me in the mosque. And so when I stopped sending them, because this I have to travel from Tamale to Kolebu every 3 weeks for chemotherapy currently. So currently, as I sit here, Monday, I'll be in Kolebu for my chemotherapy. So I went looking for the imam. So like, hey man, they say you came to my house. Is there a problem? He said, oh, I realized that every Friday you bring money for prayers. And so I have not seen you for like 2 months in the mosque. So I asked, and then the other people said if not, so somebody brought me to your house. I just wanted to know how you were feeling. And when the imam mentioned this, it has given me some kind of hope. It has made me feel like I am important in the society. You understand? Mm-hmm. And so this gives you hope to fight and fight it well. Mm-hmm. So it's not just about your words, mm-hmm. your behavior towards me, your gestures towards me. You get it? Don't make me feel like I am exaggerating the pain. Mm-hmm. My sister said, pain is pain. You understand? Yeah. The pain you might be going through, and then maybe I will go through and say, you get it? So you don't look at somebody, and chemotherapy, for me, my colleagues, a lot get a side effect like diarrhea, vomiting, and so they tend to reduce drastically. Mm-hmm. And I realized that in our Ghanaian perspective, once you are sick, they hear you are sick, especially sickness like cancer, they expect to see you paralyzed. They expect to see that you are not wearing nice clothing, you are looking weak and feeble, and then all the ways. And for me, when people, is it not, are you not the one that said you have cancer? Mm-hmm. The person says that, because the person doesn't expect to see you like this. A lot of people on the show today who know me will say, she doesn't even look like somebody who has a cancer. You understand? But I have to be strong for myself.
Reason why we call you the strong woman.
Yes, I have to be strong for myself, for my children. I have to be strong for the next woman. Currently, I get calls from Northern region, from other women who call you. Yesterday, I was on Adum TV, and the moment I mentioned I had a recurrence, a lot of my sisters have recurrence, but they are not bold enough to talk about it. Because when you speak about it, the next person like Elsie breaks down. She's living in fear. Mm-hmm. And for me, I have told my sisters I have recurrence, and I don't live like one who has recurrence. Yesterday after the Adom program, a lady called me. Oh, Atika, I also have recurrence, and I am supposed to go start chemotherapy again. With the side effects, I have taken the consent form and I'm home. It's been a month. I don't want to go to the hospital. I don't want to go to chemo again. But when I heard your story on Adom TV, I said, no, let me call you. How did you get here? How did you make it? And I said, it is God.
Wow.
It is God.
Wow.
And then my fellow sisters and those who are yet to be diagnosed.
Wow. This story that you're hearing appears to be, she's just speaking it off, but this is her situation. And if you've been with us, it's the special edition of the Nurses Cafe, bringing to you the story of Atika and Elsie, who are professional nurses. Both of them went to the premier NTC schools. One, the other one is Kolebu. I mean, that one is, we will talk about it again. And then they have lived through breast cancer, survived it, facing it head on, and helping others to live. I want us to get to what you're doing now, and then we'll be able to wrap up, because we would really want to have a long time to have discussion, but because of time. Now, what has this whole situation changed about you in terms of your thoughts, perception about life, outlook at life? What has this breast cancer thing, what has it changed? And how are you dealing with it?
It has changed my perspective about life. So now I see that we only live for today. I've taken life one day at a time. Tomorrow is not promised, but the life you live today will determine how tomorrow will be. So it has made me also prioritize self-care more because I know most of us nurses wouldn't do the self-breast examination like any other woman. I know it's a common practice. We will examine everyone's breast with the exception of ours. Or would be shy to go in for our own sisters to do the examination. So I've prioritized self-care. My perspective of life has changed. I've seen that life is just fragile, and the decision I make could either move me to be alive more, or it can either take me to my early grave. I've also learned to share my story shamelessly.
Okay.
It's not easy for me to come out and say I was abused, and I had cancer, I have 5 kids, and all those things. But today I've gotten the strength to use those lemons, which are not sweet, as lemonades to make a very nice story. And it has also helped me to love, to respect relationships more, and to love my fellow humans, because your life can just be taken away from you in a second. So whatever you do to support somebody, you have to do it. One other thing I do in my advocacy is that I try to raise funds. I just started it, but last year I got some money coming in, and one lady used it to do her MET workup and her CT scans and everything.
Wow.
And that is what I'm passionate about helping, because I see that it is highly unacceptable for a woman to die from breast cancer because of financial burden. If the disease doesn't respond to the treatment, that's fair enough. We can't do much about it.
Okay.
But if something can be done about it, and money or accessible health care is the one which is the barrier, I think that barrier can be removed. So my advocacy also tries to raise funds to help the less privileged.
Okay.
And that is how this diagnosis has changed about me. Now I spend on myself. I buy things for myself. And when I buy it, I will use it immediately. I won't wait and put it down for Christmas.
Like
no.
a kid who gets a shoe and
Yes,
wants to
I
wear
can
it.
buy a shoe from town and wear it there and bring it home.
How about your patient in 30 seconds? How
Okay.
has this also influenced your outlook and the way you manage your patients under your care?
So one that made me more confident, and now I have been a patient, so I know what patients go through. Like I said, pain. My perspective of pain have changed. So if someone says you are setting an IV line, and the person telling you that it's painful, don't say that, Madam, it is in the veins, so keep quiet.
Okay.
It is painful. So you have to really respect the rights of the patients like that. So that is what it is. It has helped me to treat my patients more empathetically.
All right. Beautiful. Attica, you have just some few minutes. Few minutes. Eh?
Few minutes.
Your story there is big like this.
I wish there would have been a part 2.
Yeah.
I know, right? I know, right? We should have had a series of this. Eh? But take us through. What has it changed about you personally, professionally, and even the way you relate to people generally?
So it has made me to become more compassionate when it comes to my work, more to sacrifice more, because to come out to tell people that, or the world, that you are living with one breast is not easy. And like Elsie said, I've become more selfish about myself. I've learned to love others because I've met other survivors in that community. It is full of love. And I've come to realize that breast cancer, even we nurses, we don't make a lot of noise about it. We don't go for screening. I bet you, Pink October, from 1st October to 31st October, how many, I don't think about 5 nurses have even gone for screening.
Wow. But they are screening others.
But they are screening others. And when I was a nurse
even being a midwife.
You're still a nurse.
For me, I have never. I have never attended any screening or no. I said there was no need.
Okay.
But on my journey, 5 nurses that I was going through the treatment with, they died.
Oh.
They died.
5 nurses.
3 midwives, 2 nurses. And so it tells you that they in the LC is a nurse. There's another survivor. I think we have about 4 or 5 nurses in the community who are survivors.
And even doctors.
And even doctors. And so it should tell you that it is not only the market women, it's not only the farmers, but even we nurses. That is why today I and Elsie, we are on this platform. Even we nurses, midwives, we get it. And so do not wait only in October.
Say it again.
Don't wait only in October to go for screening. Please. Probably if I had done my screening earlier on, I would have catch my cancer very early.
Tell them in the
Probably today I wouldn't face a recurrence. And so I encourage every nurse out there to go for screening.
Yes.
Do not wait till only in October. Even in October, you are not going for screening, my sister. You heard our stories.
Good.
You heard our journey.
Yeah.
It is by the grace of God that we are here. And I am using this platform. I have been looking for an opportunity to meet Miss Perpetua. God bless that woman. She's doing
Perpetua
great.
Furiampov, the president
The
of
president of GRNMA.
The Yasantua.
The Yasantua, the woman of all women. In fact, I want to meet her personally.
Wow.
There's one thing I want her to do for us. And that is, if she's listening, she should try and put breast cancer treatments on insurance. Teachers have it with Sweden, Ghana. And we have a lot of teachers surviving. You go there, anything you need is there. Currently, they have a PET scan there. The moment you enter that machine, it's able to detect any cancer cell in your body. Wow. The last time I called, they say it's 16,000. 16,000. Where will I get it from? But the teachers are enjoying it. So please, Mama, I know you are so passionate about breast cancer. For me, I have enjoyed the health fund twice. Even this recurring, they were there for me. 2 weeks ago, I was given a check again. And I am grateful to Mama. You can't have this anywhere. It can't happen anywhere, if not GR anyway. It can't happen.
You almost joined the Susu group.
My brother.
Now you are.
And during the strike, I was like,
look at these people.
I would have done myself.
You will finish. We'll talk about that.
So Mama, if you are listening, please, Mama, try and then put it on the insurance.
Okay.
On the Sweden, Ghana, so that we can be able to survive, Mama. You have done it for me, and I know you can do it for others. And I know you are so passionate about breast cancer. You don't want your nurses to die. You don't want your midwives to die. So please, and giving us this platform, we are grateful to share our story. We are grateful to you, you and your executives. And my number 1 chairman, Chairman Augustine of Tolong. Very vocal.
As the shout out, reserve it. When you do we'll close with the screening, you do the examination. But I hope you remind them that the screening is not for just women, men are involved. Now, I want you to give us some very closing remarks. For anybody who have been diagnosed for the first time, what are the words, reassuring, encouraging words you tell them?
Okay, since we are in the Nurses Cafe, I believe most of us watching are nurses or health workers. You know, we know too much to accept the reality. So for any nurse out there who is being diagnosed with breast cancer, I want you to acknowledge the risk, acknowledge yourself that, yes, I'm at risk, accept the treatment, and absorb the survival. You have to acknowledge that, yes, I have it, accept the treatment, and absorb the survival. That is the only way we can survive. I want you to know there is hope. We are quick to administer medications for people, but when it comes to us, we are afraid. Don't be afraid. Just go for the medication and you would and seek for help. There is a fund to help us from our association. So please reach out to people. When you have this disease, there is no shame, because when you die alone. And when you live for yourself and you live for others. So reach out and get help. And for our other colleagues who hear about the diagnosis, please, let's try not to stigmatize. Let us minimize the chit-chats about people who have got it. Let's minimize it. We talk about our friends who we ourselves nurse. Let's minimize it, because it breaks our hearts. So let us come together and support our fellow nurses or fellow health workers who have been diagnosed with this disease. Let's give them our best shot. Let them know that yes, they are loved when they come to our facility. When your friend is coming to get treatment from your ward, the person shouldn't be shy. The person shouldn't be under the cover of disguise, because he or she doesn't want a friend to know. But we should come out boldly that we are going out there to get the best treatment and to know that we are going to receive what we give out. We give out to people. So let's come out. There's hope after diagnosis. And you have to be very resilient. There'll be tough times, but once you are committed to surviving, you are going to survive it. And I want to encourage everybody to support us. I already know we have a Facebook page, so I'm going to follow the Grnma Facebook page. And I want you to also support my advocacy.
We will announce your channel.
Yes, so
chairman is
I'm going to leave it for you.
Yes, so that one will be closing.
Yes.
You've used 10 minutes.
Let's see.
So you need to, let's say you have some people for the first time, strong woman, give them the vim.
So for those who are diagnosed for this first time, know that you are not on this journey alone. There are a lot more women who have gone through the journey and they have survived. Don't listen to the advice from colleagues, from friends. Don't go to the camps and then delay treatment or for herbal. Listen, you can do the herbal, but go to the hospital. You can go to your church, but go to the hospital. Go to the hospital, you catch it early, you treat it right, and you survived it. Because, you know, a nurse from my district had breast cancer. She didn't, not even her medical soup was aware. She didn't mention it to anybody. Somebody met her in Kolebu, tried linking her up, and she said she was not ready to speak to me. One day I woke up, I saw her picture on our platform.
Painful exit.
Rest in peace. A very beautiful young girl. And her hospital, her facility, they were all surprised. And the girl said she was not married, and so she didn't want to tell anybody. She didn't want anybody to. So, and it is because of stigma. So please, my colleague nurses, I am pleading with you. We don't want stigma. Show us love. You see this pink we wear? This journey has taught me that for we survivors, pink is not just a color.
Yes.
Pink is the resilience that we used to fight.
Beautiful
cancer.
resilience.
Yes. Pink is hope. Pink is courage. And then pink is the love. Do not just make noise about or wear pink around. Support us financially, emotionally, and then spiritually. That is all I have.
Thank you.
Pink is a reminder that our body could be attacked, broken down, but our spirit will remain stronger. Pink is a reminder of the fact that when we detect early, we can treat it. This show was a special edition, and it was made possible by Madame Perpetua Ferrampofo and the entire Ghana Registered Nurse and Midwife leadership, strongly led by the production, in-house production, Grnma Media Committee, with our chairman being Reverend Philemon, yes, and myself being Kobe Blay. Thank you so much for spending time. There's so much we were supposed to talk about, but we couldn't have all the time to ourselves. Go into the comment section, leave them, go to their socials. We will drop their social handles, their TikToks, follow them, ask them all the questions. When you need help, we will announce their contact. Go to them. Please give them work to do.
Yeah.
Yes, because they are ready to help. I'm so grateful. Pink October should not be the only time you get screened as a nurse. Go and do it at any other time. you are loved, and unity amongst us is strength. Whilst we are rolling, they'll be doing the examination. I'll also have mine done, so you can see it as it goes on. But thank you for joining us. Production will keep cameras on them whilst they do the examination and the counseling and all that. So you have like some 1 minute, 2 minutes to be doing the screening. Thanks, everyone.
I volunteer to be the patient.
Oh, you want to be the patient? Okay, all right. Okay, so you can go on. I don't know how they want to do it.
Wait.
Tolong district in the northern region. I am a member of Grnma, and last year I have not been well.
For men, you can do it at any time or at any day. But for we women, you are supposed to do it monthly because there are hormonal changes that happen in our breasts when we are going through menstruation and then pregnancy. And so you wait 5 days after your menstruation, 5 days after you are done with your menstrual cycle. Then you stand in front of the mirror like my sister is standing. Then you put both hands around your waist. Then you tilt, you go forward small. So you are looking at both breasts to see if there are changes in size. Then you go up. Then you pick one hand behind your head like this. Then you use the other hand. So you use the 3 middle fingers. This one, you use 3. So you can either start from the neck, the armpit. So I will start from the neck. We have lymph nodes here. So you are palpating. You don't use the tips. You use the inside the part. So like this, you go around. And then whilst doing the palpation, you don't lift your fingers. Once you lift, you come here, you might miss the lump. And so you have to leave it and then continue. So I'm starting from my neck like this, down. I come to the armpit area. Actually, breast cancer doesn't just start from the breast. Some, their own start from the lymph nodes in the armpit. So then I come to the chest wall, then from the breast. So you go round like that. I hope you are all watching. You go round without lifting your fingers round like this till you get to the nipple. So when you get to the nipple, you either get a tissue or a cotton wool or any clean material. Then you press on the areola, then you hold, you press, you pull out the nipple, and then you press. So you are pressing the nipple to see if there are any discharges. So if it is bloody discharge, if it is yellowish discharge, then you use your tissue or your cotton wool to clean. Then you observe the changes in color. Then you quickly report if there's any changes. And if you see any lump, you quickly go to the hospital or the nearest facility. So once we are done with this one, put this one down, and then now this one goes here. And then the same way like that. So you start from the neck, there are lymph nodes there. So you are touching to see if the lymph nodes are inflamed or there are any lumps there on the chest like that. You go into the armpits area, you palpate like this, like that. Then you come to the breast again. Remember I said you don't lift. It should be a continuous thing. If not, you might miss any. And remember, not all lumps are cancerous. There are other lumps that are benign. So those ones, the benign one, you can just visit the hospital, they take it out and you are fine. So you go like that, like this till you get to the nipple, you pull the areola inside, bring the nipple out, then squeeze, clean, check for any changes in fluid color, and then you are fine. So for my men, you do the same thing. But remember I said the men, you can do it. For our hosts, I hope your wife will not look for you.
Please.
Okay. All right.
Yes, so I have
I was in Makola 3 years ago, and then a gentleman came over. Madam, can you do? I said, your wife will not beat me. I did it. He was happy.
You have consent.
Yes. So your breasts are not like ours, and so we are lifting our hands because our breasts are bigger, and so to be able to see the under end, so you will not need to, and so you also start. So. You start like this.
Why do you do the neck?
I'm doing the neck because the lymph nodes.
Okay.
Breast cancer can start in the lymph nodes. It doesn't just start in the breast. Some their own are found in the lymph nodes, and there are lymph nodes along here.
Okay.
So you can start from anywhere.
Okay.
But for me, I prefer to start from.
Okay.
Yes. So I go like that, like this, like this. I can. So I will have to go into your armpits.
Okay.
Like that. Like this.
Okay.
So I'm checking to see if there is any hard mass, if your lymph nodes are inflamed.
Okay.
Yes. Then like that, I come to your chest.
Okay.
Or because some days, even women, some days start from the chest.
Okay.
Or, so like that.
Okay.
I go around. I hope you don't get some feelings. Like
Nothing.
Are you sure?
Yes.
So with the men too, the same thing. You press on the areola, then you pull, and then you squeeze. So this gentleman, I said I found in Makola. Actually, one of his breasts, there was fluid coming out. So I asked him to go visit. Yes. So, and during my journey, when I was taking chemotherapy, I met a gentleman who was also going through treatment for breast cancer. So he was taking the same chemotherapy where 10 women, and then he was the only man.
Guy.
And 9 women, he was the only guy among us. So men also get breast cancer, but probably out of 10, it might be 1.
Wow.
Yes, or out of 100, 1%. So men also, so don't think it's only a woman's disease. Men also, I have seen. And it is only I and that guy among the 10 who have survived.
Wow.
Okay, so I leave and then you close the show. You have just 30 seconds to close the show.
Social media.
Okay. So, ladies and gentlemen, we have come to the end of the show.
Yes.
We are so excited to be on this show, right?
Yes.
For me, I wish there would have been a part 2 because I had a lot to talk about. But the little I have shared with my fellow nurses, my fellow health workers, I think at the end of the day, it is going to be of help. And so I am grateful to my mama, Mama One, Miss Perpetua. I am so grateful to you, my executives, and all nurses. The celebration for this year, the theme is what? You catch it early, you treat it right, and then you survive it. Thank you. We love you.
Bye. Please support us on social media.
Yes.
So on social media, you can find me on Medcare Hub on all the social media handles. My sister is also on TikTok.
Yes, so on Facebook, it is Abudu Atika. On Instagram, it is Abudu Atika. And then on TikTok, it is Atix Baby.
Atix Baby. And I want to encourage our nurses in the private sector. Though I am in the private sector, we also have some of us joining the GRNMA. So I want to encourage everybody, don't be left out, even if you're in the private sector. Come together and come under the umbrella, because you may never know when you need help from the association. It's been lovely coming your way tonight, and want to see you later.
Bye-bye. Unity, strength.
Yeah.
Thank you.